Mama, I don't feel good. No words any parent wants to hear. You reach out to touch your child's forehead and it feels warm. Too warm. What is the best way for you to manage your child's fever without medications? How do you make your child more comfortable? When should you call the doctor? We'll be talking about these questions and more today. First, let's talk about what a fever is and when you should call the doctor. A fever is defined as a temperature of 100.4 degrees Fahrenheit or above. Normal body temperature is about 98.6 degrees Fahrenheit. If your child is 3 months or younger, if your child is older than 3 months but has a chronic health issue, if your child's temperature is over 104 degrees Fahrenheit, if your child is younger than 2 years and has a fever of 100.4 degrees Fahrenheit for more than 24 hours, or if your child is over the age of 3 months but is fussy and can't be calmed, it's time to call the doctor. If none of these apply, you can manage your child's fever at home. So what is the purpose of a fever? Fever is one of the first lines of defense your body has against infection. When you come into contact with a virus, bacteria, or fungus that can cause disease, there are defensive steps that your body launches to defeat these invaders. Increased body temperature makes it difficult for germs to reproduce and thrive in your body, so it is important to help support your body's war against the infection. This means allowing the fever to do its thing so your child gets better faster. You really don't want to decrease the fever in your child as long as they aren't too uncomfortable. Fever is a good thing. Besides the increased temperature, normal symptoms that go along with fever include mild headaches, body aches, shivering, cold hands and feet, increased heart and breath rates, irritability, poor appetite, and lack of energy. These symptoms aren't fun for an adult and are less fun for a child, so you want to make your child as comfortable as possible. First, dress your child in lightweight clothing so the heat can escape easily from their body. If they complain they are cold, wrap them in a warm blanket, but going from hot to cold and back again is common, so you may notice that they throw off the blankets, but then an hour later they're all wrapped up tightly. Second, make sure that they're getting plenty to drink. Fever can cause loss of fluids, so you want to replace these fluids to prevent your child from becoming dehydrated. Make sure your child is urinating at least once every 6 hours. If not, this could mean that they are becoming dehydrated and you need to contact your doctor immediately. Flavored liquids that your child will enjoy should be sipped on throughout the day. A great rehydration drink can be made by mixing 1 pint of yarrow tea with 1 pint of apple juice and adding 1/4 teaspoon of sea salt. Yarrow is a diaphoretic herb that helps your body feel cooler by increasing sweating. It does not lower your body temperature, so the fever is still fighting the infection, but the evaporation of perspiration cools the skin. The sea salt will help replace the electrolytes lost due to the fever. While table salt can help rehydration to a certain extent, table salt is only sodium chloride, 2 important electrolytes, but your body needs potassium, magnesium, and other electrolytes that aren't found in table salt but are in sea salt. If you only have table salt, use that. The apple juice helps the solution taste better, so your child will want to drink it. It also provides them with some calories to fuel their bodies so they can fight the infection. As mentioned, loss of appetite can go along with the fever, so any way you can get them to take in calories is great. Other teas that may help your child feel better and keep them hydrated include peppermint tea, chamomile tea, and catnip tea. Add a bit of honey if necessary to make the tea taste better, but do not give children under the age of 1 year honey, as they are unable to fight off a bacteria known as Clostridium that may be present in honey. Never give babies honey. After the age of 1, they have developed the antibodies necessary to prevent infection. Other ways to keep your child comfortable while the fever runs its course is to use cold compresses on their forehead or give them a lukewarm sponge bath when they are feeling especially hot. Adding lavender to the water can help calm your child and help them rest. Never give your child an alcohol or ice bath, as these can do much more harm than good. So you've done all of these things. Is there a point that it's time to see the doctor? Yes. If your child is extremely irritable or extremely sleepy, if the fever lasts longer than 72 hours, if your child isn't drinking enough and is not urinating at least every 6 hours, if he or she has a rash, if your child is having difficulty breathing, if you notice signs of a localized infection, such as red hot areas around an insect bite or a swollen joint, or if they have a seizure, which is very rare but very scary, If you observe any of these symptoms, it's time to contact your doctor. No one knows your child like you know your child, so if your gut tells you he or she is sicker than you can manage, get them to the doctor. If you want to learn more ways to take care of yourself and your family in a natural way, watch this now. Thank you for joining me today to learn how to manage a fever in your child. Stay healthy, trust your gut, and have a blessed week.